Namaskar dosto, hello everybody. Today I'm back again on my channel and we'll be discussing a very important topic, the premenstrual syndrome. So what is premenstrual syndrome? So coming to the facts, why are we discussing premenstrual syndrome? We are discussing this because 90% of the Indian females, they actually suffer from one form or the other symptom of the PMS. So when we talk about PMS, it has a varied number of symptoms and it is specifically seen in the luteal phase of the cycle. So what do you mean by the luteal phase of the cycle? For this, you need to understand the ovarian cycle of a female. So it is consisting of 28 days.
The average duration of female menstrual cycle is 28 days and ovulation is said to occur on the 14th day. So before the 14 days is called as the follicular phase and after 14th day of ovulation is called as the luteal phase. Now we need to understand the hormones of the menstrual cycle. In the first half, the estrogen is predominant, whereas in the second half, the progesterone is predominant.
So we are actually worried about the luteal phase. So what happens in the luteal phase is that the progesterone increases and there are also other neurotransmitters like GABA and serotonin which decrease in quantity, and they are said to be associated with the pathophysiology of PMS. So premenstrual syndrome occurs during the luteal phase, the late luteal phase, and it continues till the woman gets her periods.
Yes, you are right. It's the female hormone progesterone which is responsible for PMS. Next, coming to the PMS symptoms.
So symptoms could be varied. They are ranged from the physical symptoms, the mental symptoms. So the physical symptoms include bloating, the patient has a sensation of constipation,
Abdominal pain, headache, migraine, backache, sweating, muscle pain, vomiting, fatigue.
and there are varied number of the mental health symptoms, which include mood swings, which include the anxiety, irritation, depression. These are not only affecting her mentally, but they're also actually having an influence on her social life. So her work environment, her home, interpersonal relationships, whether it's the parents or the boyfriend or the husband or the kids, so they all are involved. So that's why it becomes really very important for every individual who is associated with a lady who is going through these changes during her luteal phase, that is the premenstrual symptoms, to know that how to help her cope with these conditions.
So, coming to the diagnosis, how do you diagnose premenstrual syndrome?
It is basically the duration, the time period when these symptoms are happening, that is the luteal phase, that determines that the patient is suffering from premenstrual syndrome or not. And it is not, however, the extent of the symptoms which we see. Also, we need to have at least 2 previous menstrual cycles having shown these PMS symptoms either in the form of physical or mental health problems to label her as a PMS, that is premenstrual syndrome. How do we manage them? First of all, the basic things are you have a non-pharmacological, that is the home remedies could be there, or some things which are actually proven and there are studies on it. They are the non-pharmacological things, that is they are not the medicines. And the other is the pharmacological treatment. So we'll first discuss upon the non-pharmacological one. Very important is the exercise. So there are studies which have shown that exercise actually helps in improving the premenstrual symptoms. Then there's a role of kesar in the form of kava or kesar tea. These are also have shown to have some improvement in the premenstrual symptoms. Others which are proven are calcium supplements, vitamin D supplements, vitamin E supplements. These are also have been proven to be useful. Some have limited benefit, or they are still not so much of studies which can prove that they're effective, like acupressure. Even reflexology has played a very important role in improving the physical and the mental symptoms of PMS.
Then comes the role of diet in PMS. So we need to modify our diet, don't take alcohol, caffeine, nicotine. And yes, last but not the least, in the non pharmacological, our own home remedies, which range from flax seeds to turmeric to ginger to garlic and having dark cocoa chocolate, and many, many more.
So beside these, a very important thing which is being talked about nowadays is the yoga. So yoga has so many health benefits that definitely it is useful in relieving the symptoms of PMS, whether physical or mental. Also, there comes a role of meditation. So meditative exercises, breathing exercises, they are actually helping a lot. Regarding the medicinal component for treating PMS, you need to consult a specialist doctor. That means you need to go to a gynecologist to get reviewed. Suppose after 2 to 3 months of taking the non-pharmacological therapies, exercise, your diet change, and the supplements and reflexology, all these, you are still facing the problem of PMS, you need to consult your doctor. So the doctor will prescribe you the following medicines. So the first choice of drugs will be your combination pills of estrogen and progesterone, and the newer pills nowadays which contain the drospirenone and the ethinyl estradiol, the 20 micrograms are preferred. They are the preferred choice. So there are two ways we can give them. Either we can give them continuous, or we can give them in the luteal phase only, but what is preferred is the continuous, and we need to follow that regime for at least 3 months to let the effect of the drug come. Second, we can give if the patient is not getting relieved of the symptoms by the first line drugs, we can go to the second line, which can be the transdermal patches that can be followed for a 3 months period. Third, we can try the antidepressant drugs, and for that we need to take the help of a psychiatrist to counsel the woman and to see whether that lady is eligible to take those drugs or not. Fourth, there are certain hormonal injections which can be given as a depot form, like they'll be required once a month, or they can be taken after 3 months for one shot. So they are also proven to be helpful, but these have a negative influence on the female's bones, and so we need to definitely have an additional add back therapy with them. So these are not to be prescribed just like that. You have to consult a gynecologist and take after her opinion.
Another term we're going to discuss is PMDD.
Premenstrual symptoms, when they present in severe form, it is called as premenstrual dysphoric disorder, and it requires medical help from a psychiatrist. It has an incidence is around 5 to 8% amongst the women in the reproductive age group. So this PMS problem is not only affecting the adolescents, it is ranging into the reproductive life of the female and even in the perimenopausal age group. So these are the hormonal changes in the body which lead to physical symptoms as well as certain mental health symptoms, and they have effect on her social life as well. So therefore, I again plead you all to consider the ladies of your family and watch for these symptoms, and if they need medical assistance, ask them to talk about it. If they need help in forms of care, and if they need help in the form of care, or they want to talk to a specialist, go ahead and talk to them and reach them out to a doctor. So guys, please take care of the women of your family, support them physically as well as mentally, and help them out to reach out to a gynecologist when they actually need them. Thank you so much for watching this video. I hope this has given you some awareness on this topic, and any of your queries are actually welcome. You want me to talk on any other issues specifically, just put down in the comment section. I have also shared videos on reflexology and yoga and meditation, which could help you in relieving the premenstrual symptoms. So take care guys, and subscribe to my channel, and do like the video, share with your friends, and don't forget to press the bell icon. Take care, bye, stay home, stay safe.
Thank you. Love you all.